Centeno, and we're going to go over some of the common questions about the EPICL procedure. These are questions I get during a telemedicine. So, based on the pre-screening, which included a review of your history and imaging, you were found to be a possible candidate for the EPICL procedure. Now, before we have our telemedicine to gather more information on your history and your candidacy, it's important for me to answer the most common questions so you can focus on your specific questions during the visit. So what is this EPICL procedure? It's a highly advanced injection of the patient's own stem cells derived from bone marrow into the internal ligaments that stabilize the head on the neck. Now, other neck structures are also injected, and in fact, that's the purpose of the hands-on exam, to customize the procedure to you. Again, the stem cells come from the patient's bone marrow. The approach is through the back of the throat area, or the posterior pharynx. You're sleeping during that procedure. We use a 3D printed mouthpiece and an endoscope. And then we localize all of the ligaments and other structures via dual access, meaning front and side, C-arm fluoroscopy, which is a type of X-ray, contrast confirmation, digital subtraction angiography, and ultrasound imaging. Success rate of the EPICL procedure is 7 to 8 out of 10 patients respond. Almost all patients who are candidates for this procedure are upper neck fusion candidates as well. Procedure day look like? Patients arrive the day before. That next morning, there's a hands-on exam to customize the procedure to your specific problem. That's followed by the bone marrow aspiration in the morning. That bone marrow aspirate is then processed in our state-of-the-art on-site lab to extract the patient's own stem cells and concentrate those. Then the EPICL procedure happens in the afternoon, and the patient's in recovery for about an hour and then is discharged to their hotel. Everything is done under IV sedation, so you'll be asleep or heavily sedated for all of these procedures. Now, how long should you stay? If you're coming from the United States or Canada, come in the day before and usually stay 1 to 2 days after. We need you there for the day after the procedure in case we need to check on you. And so most people stay about 2 days. Some stay longer if they think they're going to be more sensitive to the procedure. International travel, you need to stay longer than that. So come in the day before and stay at least 3 or 4 days. And that'll give you, again, more time if you're more sensitive to procedures. So if you're in that category, you may want to stay 4 to 5 days or more. Possible complications of the EPICL procedure: deep infection. That hasn't occurred in more than 2,500 procedures, but it's theoretically possible. We could inadvertently injure important nerves, spinal cord, arteries, veins. This is the reason for the advanced dual access fluoroscopy imaging. So that hasn't happened with an EPICL procedure, but it's theoretically possible. There would be unknown risks, unlikely now that we have more than 2,500 procedures under our belt, but again, theoretically possible. And a long-term flare-up, which used to happen more when we first started the procedure, but is very rare now. And that's because we can mitigate this with the less is more approach in centrally sensitized patients. Post-EPICL recovery look like? Most patients have 3 to 10 days of increased symptoms. We have some patients with little or no flare-up, and on the other side of that coin, some patients with weeks to months of flare-up, and very rare cases of more significant flare-up, mostly mitigated with the less is more approach. What does rehab look like? I want you to review the PICL rehab series on YouTube. That'll be in your information that you get. Understand that thread the needle approach, And then we have prehab and rehab online available through Todd Ball PT. Should you start or continue upper cervical chiropractic, we recommend NUCA, AO, Blair, orthospinaology. Before the procedure, you could start this if you haven't done this before, but it's not required. That's important to understand. And if you've been doing it before and it gives you temporary relief, then you can continue right after the procedure. There's no time limit there. Information. If you're a candidate for the EPICL procedure and you schedule, you'll get a detailed information sheet that has far more information than we just reviewed. You'll also get a telemedicine candidacy eval that'll be sent to you. It'll be copied to me. So if you need to ask additional questions that are medical, not logistics, staff can handle logistics, but that are medical in nature, I can answer those additional questions. And you can also ask questions on Reddit via the RPICL subreddit. Thanks so much for watching. Have a great day.